So let's just get right on into it. So we're going to start with just a basic industry update. As you guys know, this whole world has changed over the past few months, and luckily insurance is an area that has been not nearly as effective negatively as a lot of other people out there. Millions of Americans have lost their employer coverage in the last month, typically from being furloughed in April or June. We've had this COVID cliff that has really dropped a ton of individuals into our into the marketplace from no longer having employee coverage. So this is a huge opportunity for not only for SEP. This has been the largest SEP year ever, but it's likely to be the largest ACA enrollment in history as well. So a lot of opportunity out there for insurance agents, a lot of individuals that need help with getting coverage. So, as we move forward, we want to make sure that that we're reaching our net as wide as possible, because there's likely to be many more avenues that we're going to see people that need ACA than what has been typical in previous years. We're also seeing a lot more competition in the market. Insurers are actually making money this year, and have been for the past couple years. They've been some of them have been testing it out, trying it out for a little while. I know we saw Oscar in 2018 test out the market and come out really strong last year. Cigna did the same thing last year, and they're going to be coming back, as we'll see here soon, very strong. And they are one of those big players, and we're going to also most likely see United Healthcare come back into the marketplace. I know they're testing the waters a bit in some other states, not in Florida yet, but I think up in Washington they're doing something up there, or Oregon. I'm not sure which one of those states, but they're testing some waters, and we hear they might be coming to Florida as early as next year. So plan pricing is another thing that we got to keep an eye out for. Due to coronavirus and the craziness that has happened, we could potentially see some give backs actually for 2020 to clients. I've been hearing rumblings about it. I haven't actually seen any of that happen yet, but a lot of people aren't taking elective surgeries. We have seen, I was in the news recently as last week, that the ACA insurers have shown tremendous profits. So because of the 80-20 rule, we may see some give back towards the end of this year to consumers, which would be great for them. However, we were also hearing rumblings that 2021 pricing could skyrocket because of coronavirus. I read an article yesterday as high as 40% that they were predicting. I doubt it's going to be that high, but we could see some very drastic fluctuations. So we just want to keep an eye out for that, and for if and when that happens. Lastly, before I get into the carriers, another implication of this COVID situation has been a number of states have extended their open enrollments. There are still currently 5 states that are still in an open enrollment, and most of those are ending in the next week or so, but California is actually open until the end of the month. So we'll see if any of those get extended even farther, but California has basically had an open enrollment period all year so far. So definitely a tremendous amount of opportunity in California for agents that don't have to deal with qualifying conditions for an SEP. So, all right, let's get into the carriers. So we're going to talk about the big 5 that we've got. But let's start with some new carriers that we have recently started working with. across the country. These are obviously, you can see in the top left, Health First and Advent. Those are going to be the carriers on the central east side of Florida. Flagler, Seminole, a few other, I think they total about 5 counties over there. I don't have them in front of me. But for anyone doing business in the Orlando area, definitely good to have those. And then basically we've got anywhere that the blue does not have a captive rule, we're going to have blue and or Anthem. We've got Care Source, which is in 5 or 6 states. Christus Health, which is going to be in Texas and Louisiana. Kaiser, which has a fairly decent footprint. Probably the most that we're seeing that is in California. I believe they're in Colorado and Georgia. Medica also, that's going to be some of our Midwestern states. I think they're in 5 or 6 states. And then First Care Health Plan, that's going to be another Texas plan. All right, so as O'Neill Marketing is growing, we're expanding into a number of different states. We're basically going to have contracts in almost every state with agents, a number of agents in each of them. Really the states that we would advise our agents and really that we're targeting ourselves are going to be obviously Florida, Texas, and California. Those are the biggest states for ACA, hands down. Colorado's also a really good opportunity in Colorado over the next that we're seeing over the next couple of years here. And then the Carolinas are big too. So North Carolina and South Carolina, as you see, see here soon, we've got a lot of carriers that are making some moves in those markets. They are non-Medicaid expansion states with pretty decent populations. So we should see some serious opportunity for our agents there. All right, Oscar. Expansion, this is the Oscar expansion across the country. The things in red are the counties that they are entering. We're seeing South Florida, we're seeing Tallahassee, Jacksonville, Sarasota, and Port St. Lucie are some good areas that we're really excited about, just to expand their Oscar's footprint and really just widen that that net that we've got, especially with what we're going to show with Ambetter. Blue, I believe last year we're the only carrier in about over 50% of the counties in the state, and this year they might be the only carrier in one county this year, I believe, and that's going to be Monroe, if I'm getting my facts straight here. Which is the Keys. Every other county in the state is going to have an alternative to blue. So that's a really big win for us and for consumers, really. Some other areas that they're targeting, Asheville's a big one. And let's see, North Colorado for Boulder is big as well. A couple new states, Arkansas, Oklahoma, and Iowa. And then they've got a pretty decent footprint in Texas as well. So, all right, Health Sherpa, quick overview of some new changes on Health Sherpa. If you guys have been using it recently, you probably already know. They're showing the agent of record, which is going to be a great tool for us. Just so we can keep track of which policies are ours and potentially see if some of them get snagged before it's too late. So that's great. SEP, I'm sure some of you have noticed this, but after there was that window of basically the marketplace not really caring about documents for a few months due to COVID, they have really cracked down, and they're not submitting any documentation to the carriers until they have processed the documents for qualifying events. So if you're seeing things like not being able to pay the premium, or calling the insurance company to pay the premium with the client, a week or so after you fill out an application, and they don't have any record of you, that's going to be why. They should be changing those dates for the requirements of when those need to be submitted. But they, at least last I checked, those had still been pushed out, upwards to 2 months out. So keep that in mind. If you're seeing any troubles, just make sure that those documents are in as soon as possible if you want those to go into effect right away. And then trainings, I guess they've rolled out some mock applications that allow new agents to get in there, learn the ins and outs, and go through a full application without messing someone else's health insurance up. So that's really great for new agents. All right, now I'm going to try to go a little faster here because a lot of this you guys have probably already seen. Medicare is a big part of what we're doing. We've got some great carriers, basically all the big ones, and then as well as regional ones. We got Baycare as well this year. So if you guys need any contracts on the Medicare side, definitely don't hesitate to reach out. We've got an awesome enrollment platform, which I'm going to show you here in a second. And we got the AHIP discount for agents that are taking AHIP, as well as offering 1,000 free mailers after every first sale, an additional 1,000 free mailers after every 5 policies. Typically, we're seeing a return rate of about 3%, which means out of a 1,000-piece mailer, you're going to get 30 returned. And if you can close 20% of that, that's 6 policies that would pay for your next free mailer. So, do the math, and we want to promote Medicare sales. So whatever we need to do to help that, and we're giving out free mailers. So this is the platform that we use. Also, it's called Your Medicare. You're going to be able to see all plan details. It'll show you any Part B givebacks. It'll show your star rating, cost. You can factor in your the client's prescriptions, doctors, all that stuff. So really amazing platform. And you can also do everything electronically. So you can send your client scope of appointment and to sign the application via email and or text. So allows you to be completely virtual and do everything compliantly. So really amazing tool, and everyone, including myself, that have used it over the past few months here, absolutely love it. So short-term indemnity carriers, these are what we're working with right now. We've got a really great portfolio with these guys. Philadelphia Americans, probably the only indemnity product right now out there that's that we really like now that short-term medical is out there with 12 months up to 3 years. Really knocked out a lot of indemnity plans that weren't basic hospital indemnity plans, and Philadelphia American's really the only one, in my opinion, that's worth anything. So we're selling a lot of United Health One and National General for short-term medical. Love it. Also throwing on minimum essential coverage to those plans. Great way to increase your commissions and give your clients more of a holistic package that'll include those essential health benefits and doctor's office visits and some things that there are gaps in the short-term medical policy, and the MEC really helps for that. So life carriers, we've added a lot since we last spoke. Most likely, these are all of them. We've got a really awesome enrollment or quoting and enrollment system that we use. You can see all these carriers side by side, and we've got a spot on our website for inquiries, and we can run quotes for you. Basically, for the most part, no one gets appointed until we're submitting a business. We've submitting a piece of business. We've had a lot of this where agents will get appointed with every carrier and then sell one of them because they like it a lot and stick with that, and that's all the only one they sell. And then there's 15 appointments that go unused. So if you guys need to run quotes, the quoting platform you don't need an appointment for. It's an awesome quoting platform. If we need actual illustrations, we're happy to help run those for you too. So awesome stuff. That's everything is all of this is stuff is available on our website too. So final expense, senior life. We're really pushing this hard this year because they are a fantastic company. We see a lot of opportunity in the final expense market this year. I think they had the best year. If you just looked at what they did from March to July, it beat any other year in their history. So just with all of this coronavirus stuff going on, final expense is something that's on people's minds. And it's a really, really hot market for that right now. And senior life is hands down the best as far as benefits to the client go than anyone I've seen out there. Also, we've got some new dental carriers. Nationwide is a great dental plan that also has level commissions. So, you've got, there's no dip in renewals from year to year. So we love that. And, if you need those appointments, please let me know. Obviously, bundling is a big way to increase your commissions, right? So we want to always make sure not only do we have the medical, but we've got dental, we've got accident, and as well as life. So there's no better way to double, triple your overall take-home commissions than to make sure we're not just signing someone up for medical coverage and not at least inquiring and seeing if we can make it a better policy for them by adding some additional things like dental, accident, life. So more on the sales strategies here to come. MEC is something that we've another aspect of that bundling is we really think that the MEC products are fantastic groupings for the short-term medical specifically. Most of those short terms do not include your essential benefits and doctor's office visits and x-rays or blood work or prescription drugs. MEC products do. Awesome pairing there. So definitely bundle your products, make more money, and offer much more complete coverage to your client.
But the purpose of this slide is to talk about the fact that it's time to get ready for selling now. And I think, one of the best ways to do this is to get an Excel spreadsheet or get your list from us, put it up and examine it, try to make a determination when you can get all these people renewed, but then see which ones of them you can use to try to drive 3 more leads from each one of them so that you can increase your block at open enrollment and be ready to go. Additionally, I think you need to set a goal of how many lives in increased business you want to get for the year, 20%, 25%, 30%. Share that with us and let us see how we can help you increase and build your block so that the residuals grow year in and year out. Obviously, the goal here is to get to as many people as we can so we can keep the retention and, of course, then sell them other products down the road. It's imperative that we start now, even though it's August. I know some of you might think, well, we got plenty of time, but the best prepared people are the ones who are going to sell the most. And then those are the ones that are going to be able to utilize our services the best to help you close as much of your business as possible, because we'd hate to see you leave anything on the books at the end when you can't, if you feel like you can't get it all done.
All right, great. Thanks, Chuck.
Sure.
Yeah, can't stress it enough. Just attacking your book of business, that is, or attacking, sorry, your renewals, really the best way to grow your business and continue building that book. So try to make sure that no later than September we're really reaching out to those clients and asking for referrals too. Again, to continue on that, just every client knows a ton of people, and whether they know, just some friends that are in kind of the same situation that they're in, or a business owner that can help lead to maybe a group sale, which could be great. You're not going to reach any of these other people if you don't ask. And if you do a great job for your client, they're going to want to help you. So they're going to want to help you grow your business because you've done such a great job to help them. So can't stress it enough. Sometimes it's not the easiest thing to do, but when you get in the habit of it, it's like breathing. So we have carriers that are asking for marketing dollars, or proposals like yesterday. So if you've got any ideas, if you want to put things in, a newsletter, or you want to do a radio commercial, or digital advertising, digital marketing, if you've got a game plan, please get it to us as soon as possible. I'm not sure where Matt put it in here, but I'll make sure that he puts a link to that in the email that we're going to send out right after this. A couple quick things that I wanted to go over about our website that we've added. Obviously, all of our products are here. And if you're licensed in some other state and you're like, okay, well, what can I sell in that area? You can come in here and you can click on a state, and it will tell you all the carriers that we have in that state. So really great tool. Please utilize that. Matt spent a good amount of time working on that, and it's working great. So if you need that, that's a good tool for you. Also, keep in mind we have the help on here it is, marketing dollar request form. Fill those out. If that's something that you're interested in, please let us know right away and fill these out as quickly as possible. The carriers have been asking for a report, or for a game plan for quite a while now. We're going to be finalizing ours no later than Friday of next week. So if you want to be a part of that, and you want the carriers to help pay for some of your marketing, let us help you out, and we can add to our marketing campaign there. Also, any links and guides for the Big Wave training, another great way to get free leads. Awesome tool. Lastly, on the website, I'd be amiss if I didn't bring this up, but everyone's got one of these pages. We've got a lot of great tools on here. Especially a great tool is the support ticket tool. So if you've got questions that you don't want to get stuck somewhere in an inbox, that hopefully we Matt and we've done a pretty good job on getting back to people and making sure things don't slip through the cracks, but mistakes always happen, and that does happen. So if you want to make sure that we don't miss anything, as rare as it might be, input a support ticket. It will track everything and make sure that you have any updates to that support ticket, and that it doesn't get buried somewhere. So great tool. Please use it. We put a lot of work into creating it. So if you guys could use it, that'd be great. All right. Last but not least, we are recruiting new agents. And if you want to make $100 next week, bring an agent to next week's webinar. We're going to do another industry update. I'm assuming we're going to have a lot more information on Better next week. I apologize. It's been almost 40 minutes. I was trying to keep it at 20. Matt told me there was no way I could do that. So I tried. Next week it will be shorter, I promise. We won't be going over all the same things. We're going to try to keep it fresh and new. So bring an agent to next week's webinar. We'll give you $10 just for bringing an agent. And then if they join us, we'll give you $20, and you can choose if you want them to be part of your downline and whatnot. So that's great. Also, we'll send you another $10 if you like us on all our social media. Help us kind of build that up, and we'll throw you a few bucks for it.